The buccal fat pad removal procedure is a quick 30-minute local anesthesia case where we're removing the fat, which is in the lower part of the face called the buccal fat pad, or the fat pad of Bichette. And an incision is made right in the inside of the mouth through the mucosa. We find the muscle that's protecting the buccal fat pad, dissect between the fibers, and then really the buccal fat pad is delivered on its own and it comes out almost by itself. One of the cool things about the procedure is immediately afterwards you're going to see a result. Right when we finish procedure, I'll take a mirror and show the patients a nice little subtle contour of the lower cheek, but then you kind of swell, and it takes about 3 weeks to 2 months to see the final result once that swelling goes down. Well, all the incisions are made through the inside of the mouth, and that's the beauty of it. You're not going to have any visible scarring. Throughout the healing process, you're going to feel a little bit of firmness on the inside, and that's the scar tissue that's building. My ideal goal when I personally do the procedure is to do minimal dissection and allow the buccal fat pad to deliver itself. And when that's the case, you're going to get a little bit less of that bothersome scarring. Yeah, so in reality, one of the most important things is going to be choosing your correct patients and identifying who's a great candidate and who isn't. So number one, this isn't a procedure that's going to give you a completely new face. It's just going to add a subtle contour right below the cheekbone area, and it's going to be something that's no different than using contouring with makeup. Now, obviously, and with this procedure, you'll be able to do it without. Now, a couple of important aspects in patient selection. Number one is going to be choosing someone with an ideal body mass index. The fullness in that area, though it can be genetic, though a lot of us carry that weight a little bit longer, the ideal patient is going to be someone who's at a lower body weight, and that's when you're going to get your results where you can see a strong cheekbone on top of seeing the contour in the buccal fat pad area. The second candidate is going to be patients who really only want a subtle change. Anyone who wants a drastic change, you're going to want to augment the cheekbones themselves, and then also going to want to remove the buccal fat pad. Now, when it comes to finding patients who really are going to be the strongest candidates, the bony structure is going to make a difference. Someone with already naturally high cheekbones will see more of a significant improvement. Any procedure you can deliver to a patient, there's going to be investment both from my time and from the patient's time and healing process. Now, the beauty of this procedure, it really helps give you a look where you have a little bit of a skinnier, slimmer face, and most of the patients are people who don't want to enhance something that's already nice, but they've always had a round baby face and they just want to look a little bit more their age. Generally speaking, having round, full baby cheeks, even though it's something that we want as we age, a girl in her 20s, it really can help improve their confidence by providing some slimming of the mid-face.